of different side effects from medications used in vasculitis. You can see skin rashes, you can see problem like the white blood cells that are over in that upper corner, sores on the tongue. Down here you see some lung involvement. That's a CT scan of the lungs. Some hair loss, some liver issues. This is a picture of that glomerulus, that kidney we were just talking about. You can see kidney issues and increased risk of infections. So these are all side effects from medications that are used in vasculitis, and these are all signs of vasculitis. So problems with your white blood cells, skin rashes, sores in the mouth, lung problems, hair loss, liver issues, kidney issues. So it can be really difficult sometimes when we're screening to see what is a side effect from the medication you're using and what is active disease. And that is where definitely communication with your doctor and keeping sort of really a close eye on what you're feeling and your symptoms, knowing your body, knowing what a flare is for you. Obviously when you're starting a new medication, kind of keeping track of what new things have come up that are different from your baseline, because that can help us. I mean, of course, we're going to order tests and studies and try to pull out the story as much as possible, but those are things on your side that I think, just to see that a lot of these features have so much overlap that it can be complicated. And so starting a new medicine and kind of keeping an eye on some of these things, especially if you know what the side effects could be, and talking to your doctor about them is important. So, like I said, the side effects of the medication can have significant overlap with disease manifestations, and that can make the management of vasculitis complicated, right? If you're on a medicine that's causing the side effect, we want to stop the medicine or pull it back. If you're on a medicine and you're having a flare, we want to go up on the medicine. So it's opposite reactions to the same sort of possible presentation. With an increased understanding, obviously, of how these diseases are happening, the disease pathogenesis, we've been able to develop new drugs that are more targeted. This helps us minimize a lot of the risks and toxicities, but this does come at a cost. So with the newer drugs, we have obviously less data on long-term effects unless they've been used in other illnesses for a long period of time. And again, even if they were used in other illnesses, those patients have different risk factors. We're using different doses, so you can't always translate that data to our situation, right? Other things is price. So price of rituximab or tocilizumab for a year is about $36,000. The price of prednisone for a year is $120. Again, these are just things that, in terms of the larger healthcare system, we need to be aware of. And many current trials are evaluating how fast and safely we can stop or minimize some of these medications. I just listed a couple of them right now, where we're trying to see, can we stop these medicines, and how will we do, or how can we monitor and pull off slowly in a safe way. So the more we learn about our enemy, and then the more weapons that we have at our disposal, I think we can get better targeted therapies for our patients with less side effects, making all of us happy, and not leading to over-medication.